Hi, my name is Daniela Zavolta, and I'm the Vice President of Nursing here at Care Unlimited. Today we are going to review tracheostomies. First, we're going to talk about the difference between single cannula and double cannula. Single cannula trachs only have one piece to them. The double cannula trachs are the ones with the inner cannulas. So this is what we call a double cannula, the one with the inner cannula. And the one that does not have the inner cannula piece is the single cannulas. Some typical types of single cannulas would be a Portex or a Bovina trach. One of the most popular inner cannula trachs that you'll see is a Shiley. The difference between a cuffed and an uncuffed trach. An uncuffed trach won't have any balloons down at the end, where the cuffed trach will. And if you're just looking at the trachs, the way to tell the difference whether it's cuffed or uncuffed is you will see these tubes that you can insert your air into to inflate your balloon. How many cc's of air that is put into your trach is always a doctor's order. So you would put as much air as the doctor wants you to put, and then the little balloon will inflate. And the way to tell that it's inflated is this balloon part here at the end of your tube will also be inflated. When it is deflated, your balloon on the outside will also be deflated. So that is the way that you will know whether it is inflated or deflated. The reason that we use air in our balloons is you never want to put water in it, because if there's water in it and it ends up tearing or bursting, then the water could cause the patient to aspirate. Next, we are going to talk about sterile and clean technique. If you're lucky enough to have a tracheostomy cleaning tray in the home, this will be sterile. So what you're going to want to do is you're going to want to open it, staying as sterile as possible. Open your cleaning tray, and you will find sterile gloves. So remaining as sterile as possible, you're going to put on the sterile gloves before you touch any of the equipment in the tray. Then next, what's usually in this tray are 4x4s, gauze, which is already pre-slit for you, pipe cleaners, a cleaning brush, Q-tips, and an extra set of trach ties in case you would need them. These also act as cleaning trays, so you can put the appropriate solution that you're going to clean your trach with in these trays. More often than not, the cleaning solution is going to be normal saline and peroxide. So you would put that mixture in one of your cleaning trays. The next cleaning tray would just be normal saline to rinse. Then you're going to take the inner cannula out of the patient's trach, and you're going to put it in the solution of the normal saline and peroxide. Then you're going to either take your pipe cleaners or your brush, and you're going to scrub and clean the trach. You can take your pipe cleaners and clean it. Once it's all clean, then you're going to rinse it in the normal saline solution. Then you have your clean inner cannula. At this point, if you don't have one to replace it already, you would put the one that you just cleaned back into the patient's trach. If you don't, or if you do have an extra one, then you would take the new one out of the box, put the new one in, and the one that you just cleaned will be stored. You want to ask the family how they store their clean equipment. They could either put it in Tupperware or a paper bag. You don't want to store it in plastic because